Hello, my name is Samantha Cunningham. I am an LPN and I have been for about 8 years, and I'm currently in the program to obtain my ASN RN degree. So today I'm going to talk to you about rheumatic fever. Rheumatic fever is a very serious illness, and some causes of rheumatic fever is the bacteria is group A beta hemolytic streptococcus bacteria. And so this is the cause of strep throat and also scarlet fever. So if you have strep throat or scarlet fever and you do not get treated, or you get antibiotics, let's say, for the strep infection, but you don't complete them, or you get improperly treated and don't get the correct treatment needed for the strep bacteria. So this could then lead to rheumatic fever. And rheumatic fever is not contagious. It is actually a immune response instead of actually an infection. So it usually takes about 1 to 5 weeks to develop rheumatic fever after a strep throat or scarlet fever infection. And anybody can get it. Some signs of strep throat, are sore throat, redness, some enlarged lymph nodes, like white patches in the back of your throat, fever. And then scarlet fever is usually like a strawberry tongue or like a rash over the body. And that is actually caused by the toxins from the strep bacteria. So some signs and symptoms of rheumatic fever is fever, painful tender joints, which would be arthritis, and that's usually in the knees, ankles, elbows, and wrists. There's some fatigue with it, jerky, uncontrollable movements, which are called chorea, painless nodules under the skin near the joints, which is a rare symptom. A rash that appears as pink rings with a clear center is also a rare symptom. And then if rheumatic fever is left untreated, it can actually lead to heart problems. And some of those can be like congestive heart failure. So your shortness of breath, tachycardia, edema, chest pain, things like that. So it is very serious. Like I said, anybody can get rheumatic fever, but it's most common with children in school, so age to like 5 to 15. It's pretty rare in children under the age of 3 and for adults. And the most likely place to get strep would be, at school, daycare, or even like a military training facility. And if you get rheumatic fever once, you are more susceptible to get it again. So like I said, some complications of rheumatic fever are heart problems. So that is called rheumatic heart disease. And what it does is it weakens the valves between the chambers of the heart, which then, leads to the symptoms of congestive heart failure, like the edema, fluid buildup, shortness of breath, tachycardia, etc. Rheumatic heart disease can then lead to severe rheumatic heart disease, and that will probably require open heart surgery, and if not treated, could even result in death. So sometimes you could hear like a heart murmur, or if you see on imaging cardiomegaly, which is an enlarged heart, or even some pericardial effusion, which is fluid around the heart. So diagnostic testing for rheumatic fever, there's not one specific test for this disease. It is based off of signs and symptoms, and then, of course, if they have signs of a strep throat, they would do a strep swab. They can also do a blood test to check for antibodies from a recent strep infection. They can do an EKG to check, if there's any arrhythmias or anything with your heart, and then they can do the echo to see if there's any fluid buildup around your heart or if your heart is enlarged. So then treatment obviously would be antibiotics to treat the underlying group A strep infection. Very important. You want to educate the patient to take all of the antibiotics. Do not stop once they're feeling better. Obviously, we know this. They can also take some NSAIDs for pain, fever, inflammation, or like Tylenol. And for the patients who develop rheumatic heart disease, usually they're going to be on some kind of heart medication for those symptoms. And now prevention is good hand hygiene. You want to make sure you wash your hands often, especially, after you're touching germy things, or, if you're in the doing patient care, anything like that. You want to wash them often, wash them for at least 20 to 30 seconds. Now, if somebody gets rheumatic fever, they're going to be put on prophylactic antibiotics. And usually they take these antibiotics until they're about 21 years old. And they can either do that by taking a pill daily, or they can get like an IM injection weekly, but they're going to be on antibiotics for until they're about 21. So yeah, that's what I got. That's rheumatic fever, and it is a serious illness. And yeah, if you suspect you have strep throat, definitely go get treated. Definitely take the antibiotics as prescribed. And if you feel they're not working, or you're having reactions or anything, you need to definitely let your physician know. Thank you.